Hi, everyone. My name is Jessie Tong. I'm a new assistant professor from the Department of Biostats at Johns Hopkins, Bloomberg School of Public Health. And today I'm going to introduce a recent publication related to advancing the interpretable regression analysis for binary data. And in this work, we introduce a novel distributed algorithm approach. Okay. So, in the EHR data, one of the significant challenges is to study the rare diseases. And when we have the data on rare diseases, usually we'll have the outcome will be the rare binary outcomes. And the lack of sufficient cases, for example, the patients with diseases in the data set, will lead us to biased estimates if we don't account for such rare disease properly. So the biased estimates will be related to the effect of a treatment or a medication in the observational studies when we're using EHR data. So if we want to increase the sample size to conduct analysis on rare disease, a straightforward way is to combine the individual patient level data from multiple hospitals together. And by pulling all of the patient level data together, such strategy will help us to improve not only the sample size, but also the statistical power and also the generalizability of the statistical findings and the clinical findings. However, in practice, sometimes given the time-consuming regulatory approval process and also the diverse laws across different countries and across different institutes, it is really hard for us to pull all of the patient level data together from different hospitals or different studies. So that's why we need some different ways to analyze the multi-site data. And meta-analysis method is treated as the most commonly method and the very promising method to conduct evidence synthesis. And when we look at this pyramid of quality of information, meta-analysis is on the top of this pyramid for evidence synthesis. And the meta-analysis method has the major idea of divide and conquer, which means that within each collaborating site, a regression model will be fitted to obtain the point estimate and corresponding variance. And these summary level statistics will be transferred to the lead site or the coordinating center to combine together to synthesize the evidence together. However, there are some studies and papers show that when we study the rare disease problem and when we have rare data, meta-analysis method cannot perform very good as the pooled analysis or even some federated learning algorithms, which means that in terms of estimating the coefficient in a regression model, meta-analysis method will have relatively low accuracy. So that's why some distributed version, like privacy-preserving federated learning algorithms have developed. And these federated learning algorithms, compared with meta-analysis method, it has similar strategy, which means that it only requires summary level statistics to be shared instead of patient level data. And in addition to summary level statistics, these federated learning algorithms enable fitting statistical model in a federated manner. Sometimes it will based on some likelihood-based method. And as I introduced at the very beginning, we need to develop some federated learning algorithms to analyze the rare binary data. And in terms of analyzing binary data, there are some federated learning algorithms have been developed. For example, there is a method called GLORE, which uses an iterative way to fit the logistic regression model for binary data. And considering the communication cost, the GLORE method, which is the iterative method, will take more than 10 or 100 iterations to be converged, which depends on the initial values. And in practice, since we want to save more human-in-the-loop efforts, so that's why some non-iterative methods, for example, ODEL or robust ODEL, have been developed. And compare with the iterative method, these non-iterative method will only requires 1 to 2 rounds of communication across the lead side and the collaborating side to transfer their summary level statistics. And these federated learning algorithms are designed for binary data, and they are focusing on feeding the logistic regression model to get the odds ratio or log odds ratio after feeding the model. But in practice, there are a lot of discussion and debates related to the choice between relative risk and odds ratio. And given better collapsibility and interpretation for relative risk, and this metric, relative risk, will be more preferred by the physicians and also the epidemiologists in most of the prospective studies compared with odds ratio. And if we want to obtain the relative risk, people will usually use the Poisson regression model to estimate the relative risk, to obtain the relative risk. And however, to estimate the relative risk for binary data using Poisson regression model, we need to make some modification on the Poisson regression approach. And a few years ago, a modified Poisson regression approach has been developed for the binary data. And what we developed here is that how can we develop this method in a distributed algorithm? And today I want to introduce what we developed. It's called the ODEP-B, stands for one-shot distributed algorithm of modified Poisson regression model for binary data, especially for rare binary data. And the main technique we use here is called the surrogate likelihood approach, which was introduced by Michael Jordan back in 2018. And this surrogate likelihood approach has a major idea is that if we have the multi-site likelihood, we can conduct a Taylor expansion. And since this is the ideal case, because in practice, usually the patient level data cannot be pulled together. So after we have this Taylor expansion, the higher order term of this multi-site likelihood actually can be approximated by the Taylor expansion higher order term of a local likelihood function. And from these two equations, after we arrange these two, we are able to get the surrogate likelihood function. And in this surrogate likelihood function, we only need the local size likelihood and also the gradients, which are the summary level statistics from the other sides. And by using the surrogate likelihood function and maximize this likelihood, we are able to estimate the surrogate estimator, which has the interpretation on a relative risk, which if we follow the Poisson regression model. And this is the pipeline figure to show how it works. First, suppose we have the patient level data from the first site, and we treat this first site as the lead site. Then at the first site, we'll fit the Poisson regression model and get the local initial value, beta bar. And this beta bar will be transferred to our collaborating sites, and each site will use their own patient level data to construct their likelihood function and then estimate the gradients and the second gradients. And compared with the Michael Jordan's method, our method also requires the sites to transfer their second gradients, which will have better accuracy. And after each site have their aggregated data in terms of gradients and second gradients, these values will be sent back to the lead site, site number 1. And then, as we introduced in the last slides, site 1 will construct the surrogate likelihood function, and then we can obtain our final estimate beta, which has the interpretation of log relative risk if we are fitting this Poisson regression model. And we have run some simulation studies to demonstrate the performance of our method. And in this figure, we have two major big settings. First, we set the number of sites to be 5 to mimic a smaller network. And then we have K to be 50, which is to mimic a larger research network. And under each big setting, we simulate different values for the coefficient. And also here, alpha represents the intercept of this regression model, which has the interpretation of the prevalence of the disease. And the smaller value of alpha does the rare of the disease. So you can see here, compared with our proposed ODEP method, the meta-analysis method is not able to estimate the coefficient very well in terms of smaller prevalence for the rare disease. And we apply our method to the real-world data, and we have two use cases. And the major idea of this real-world data application is to investigate a relationship between COVID-19 viral test positivity and the symptoms and conditions associated with the long COVID in children. So in the first use case, we have the centralized data from the PeaceNet research network, which has 9 children's hospital patient level data pulled together at a central database. And using this centralized data, we are able to apply not only the federated learning algorithm that we develop, but also the pooled version of analysis, which is treated as the gold standard. And then we can compare our federated learning algorithm with the pooled analysis to see if there is any accuracy loss due to the data sharing constraint. And for the second use case, we apply our method to a truly decentralized dataset setting, which means that the data from PeaceNet, Odyssey, and also One Florida, these research networks are not able to share their patient-level data together. So this gives us a truly decentralized setting, and since the data cannot be pulled together, we cannot apply the pooled version of analysis, so we just applied our federated learning algorithms to this decentralized data sets. And here is a result for the use case number 1. And we look at 5 different outcomes and look at the relationship between the viral test positivity for COVID-19 with different outcomes independently. And from this figure, you can see that compared with the pooled analysis, which is treated as the gold standard, our method can obtain very close results to the pooled analysis compared with the meta-analysis method. And when we look at the prevalence of the outcomes here, you can see meta-analysis method is not able to handle the rare disease very well under such settings. And also in this figure, we observe that for all of the outcomes, the hair loss, loss of smell, change in smell and taste, mix, and Addison disease, the viral test positivity is significantly associated with these outcomes. And then we apply our method to the use case number 2, which is the truly decentralized setting, and compare our results with the use case number 1. And since in use case number 2, we have larger sample size, the confidence intervals for different outcomes for the coefficient of relative risk, they are much narrower compared with use case 1. And also similar as use case 1, we observed that for hair loss, loss in smell, changes in smell and taste, and MISC, the viral test positivity is significantly associated with the outcomes. Okay, to summarize, in this paper, we propose ODEP-B, which is effective federated learning algorithms for feeding the modified Poisson regression model to study the rare binary outcomes. And compared with the largest regression model, Odell and Galore, ODEP-B provides inferences on adjusted relative risk with robust variance estimator. And also by providing relative risk, it provides a better interpretable regression analysis coefficient when we analyze the binary data using EHR. And also, ODEP-B is easy to implement, given it only requires one round of communication. And since we have applied this method to the real-world setting, we have demonstrated the applicability of our proposed federated learning algorithm. And if you are interested in applying the ODEP-B in the real-world setting in your database, please feel free to use our R package and also use our website PDA and PDA OTA for further details. And that's all I have. Thank you very much.